So how's everybody doing for a Friday of week 2?
Good.
Everybody getting organized with all their classes and their due dates and all the things they have going with each class? Have a good calendar going?
Yes. Still
Okay.
adjusting though.
Yeah, sure. That takes a couple of weeks, sure.
I have a question.
Sure.
Will there be a math question on this
There's
quiz?
no math questions on any quizzes. You'll end up with 5 math questions on each exam. And we'll talk about that in a little bit. Talk about because you have a study guide as well. So today, um, we'll do the quiz at the top of the class, and then we'll go ahead and review the quiz. That's where I do a lot of my lecturing from the quiz, because you'll see in the quiz, whether you get the question right or wrong, you're going to get a rationale that I think is very helpful in reviewing the quiz questions. The other nice thing about having the rationales is when you're preparing for your exams, you can go back to your quizzes and look at the rationales. Okay, take these, I make up these quizzes right from your readings, the PowerPoints, and your concept recordings. Have you guys been watching the 2 weeks, the concept recordings? Yes? I would highly encourage you to watch that. That's part of your classroom preparation. They're very helpful in introducing the concepts we're going to be covering that week, and also helpful in preparing to take the quizzes. Okay. So go ahead and after that, we'll go through the quizzes. We'll do the rationales. I'll do quite a bit of teaching from the rationales, and then I'll review my notes to see what we haven't covered. And we'll go through that for weeks 1 and 2 content. And then I have a exercise we'll do in breakout rooms with regards to school nursing. And we'll do that towards the end of class. How does that sound? Okay. So everybody go ahead and pull up quiz 1. I'm going to put the access code, which is my last name, in the chat. And that's how you get into the quiz. If you try to get on the quiz before 4 o'clock, go ahead and refresh. It's available now. So it's 15-minute timed quiz. And we do have some students that have some extra time with accommodations. So I think that's an extra 6 or 7 minutes. So let's see, it's about 4:04 now, 20 minutes. So when you're done the quiz, don't forget to hit submit. Okay, and then you can go off camera after you've done the quiz. You got to stay on camera during the quiz since it's a proctored key grade assessment. And then we'll get going. How about 4:25? That will give the students with accommodations their extra time. Okay, so go ahead and go into the quiz. Let's make sure everybody's muted. If you have any questions, I'm going to mute myself too. If you have any questions, put them in the chat for me. Okay, so go ahead and get started. Is everybody?
Do you have the code?
I just put it in the chat.
Oh,
Okay, so I'm going to go ahead and mute myself. Take your time on the
I don't
quizzes.
see the code, Miss Marvel.
Okay, who needs the code? It's
Charmaine.
Yep, it's my last name, capital MARVEL.
Oh, okay. I see.
Okay,
Thank you.
I'm going to mute myself and mute everybody else, and we'll see you in about 20 minutes. Okay. Okay, so if everybody can come back on. All right, how'd you do? Thumbs up from Clorinda. How did you like the rationales being in there?
I like the
I
rationale.
did appreciate the rationales.
Yeah, yeah. I just started doing that recently, last term. I think they're a really good addition. Okay. Let's see. Let me double check got some chats going on here. All right, let me double check one sec. I'm gonna make sure I have this pulled up. Okay, can you guys see my screen? Yes, no?
Yes.
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 All
Yes.
right, thanks. Okay. Okay, I tried to mix up the questions with a whole bunch, tying in multiple concepts from weeks 1 and 2. Okay, so hopefully if you did your pre-recorded, if you watched the 2 pre-recorded concept recordings, looked at your PowerPoints, did your readings, you did okay. Okay, because that's where I pull all the quiz questions from, all of what I just said. All right, so let's start with the first question. Before we get to the question, what in your readings, what is the difference between community-oriented nursing and community-based nursing? Without looking at your rationales.
One of them is a hospital setting, and the other one is like at home,
No,
in the
oh,
community.
okay.
And one of them is in the community. My fault. One of them is in the community, and the other one is in the home.
Correct.
With a person.
Correct.
One person.
I have the oriented as like the whole.
Right. Okay. So the way I remember it is with community-oriented nursing, that's the big picture. Okay, you're looking at the whole community. Okay. Community-based nursing simply means that you're based in the community and taking care of individuals in the community. Okay, so which is an example of community-oriented practice? That would be C, right? You're evaluating the outcomes of a community vaccination program. You're looking at the whole community. And by the way, I just want to mention the attachments you get each week. You get the PowerPoint, you get the concept recording, but you also get a third attachment. It's called student notes. Has anybody opened that yet and printed those out? What the student notes attachment is essentially the PowerPoint broken into 3 slides per page, and then it gives you lines on the right-hand side to take notes. You guys figured that out yet? Okay. The other place you can take notes during lecture is your study guides. I sent out the exam 1 study guide in week 1, and it goes through week 1 concepts, week 2 concepts, week 3 concepts. And there are big boxes to the right next to each concept. So you can be taking notes in there as well. Some students like to take notes on the actual student notes page according to the week that you're in. and then transfer all those notes over into your study guide. Other students like to take notes right in the study guide. Okay, so there's your resources. Okay, so the rest of these answers in quiz 1 or question number 1 are all examples of community-based nursing. Okay, illness care of individuals in the community. That's community-based nursing. Educating a child and a school teacher on the use of an inhaler. That's a school nurse based in the community, based in the school. And like Clarinda said, home health delivered in the community. That's individualized community-based care. Okay, so if you look at the rationale, okay, community-oriented nursing is oriented around the entire community or the population, right? Primarily focused on health promotion rather than illness care. It's a whole group of people rather than individuals. And if you look at a more detailed definition of community-based nursing in your rationale, it's setting specific. All right, so it could be, what are some other places community-based nursing happens?
In the homeless shelters?
Homeless shelters, neighborhood clinics, right? Medical office buildings, schools, hospice centers, rehabilitation centers, correctional facilities. These are all examples of community-based nursing. You're based somewhere in the community. Okay, so you're taking care of people where they live, work, maybe attend school, right? The emphasis for community-based nursing is on acute and chronic care. Okay, does anybody have any questions on the difference between community-oriented and community-based? Public health is also an area of community-based, of community-oriented nursing. Think of what the public health nurse does. Public health looks at the community as a whole, right? Okay, any questions on that? Because it is important for you to know the difference. It's going to be on your exam. Okay. Let's go to question 2. And whether you got it right or wrong, the rationale is the same thing. So you're provided a rationale with a right answer or wrong answer. Question number 2. This was a week 1 concept to study, which was Healthy People 2030. And it required you to go to the Healthy People 2030 website. Okay. And so if you went to that website and read about Healthy People 2030, hopefully you got this question correct. So which describes the purpose of it? First of all, let's talk about Healthy People 2030. What did you think about the website? What did you learn about the website? Did you enjoy reading through the website if you went to it? Okay, I don't like to call on people, but I really want this to be interactive. So I need students to participate. What did you think about the Healthy People 2030 website? What did you glean from it?
It was informative. Had a lot of information on it because it was different from they changed, like, I don't know, every so often.
Every 10 years.
It was like a 2010. It was a 2010.
Yeah.
Now it's this or whatever like that. So it was a lot of different information on that also.
Healthy People started in the 1990s, and it started with Healthy People 2000, and it went to Healthy People 2010, 2020, and now we're at 2030. Okay, so the correct answers here were A, B, and D. Provides a framework to improve the health of all Americans, attain healthy, thriving lives, and well-being, free of preventable disease, disability, injury, and premature death. Okay, C is a wrong answer. It has absolutely nothing to do with nursing curriculum. And D is a correct answer. Promotes healthy development, healthy behaviors, and well-being across all life stages. So if you look at the rationale, Healthy People 2030, along with 2020, 2010, all the way back. These are national objectives, right? They encompass the whole country. And they are geared towards improving the health and well-being over the next decade. And if you looked at the website, you could see side-by-side comparisons of what national objectives were 20 years ago versus what they are now. Okay, so trying to, and they're very broad, obviously, because they're trying to encompass the whole country. Okay, so trying to achieve these broad and ambitious goals, and they are very broad and very ambitious. Okay. Embedded in those broad goals, if you read the website, are much more specific objectives of how they're going to obtain those goals. Okay, so the 5 overarching goals, talked about a few, 3 of them are in your answers. We already covered attain healthy, thriving lives. The second bullet wasn't one of your answers, but it is one of their objectives, to try and eliminate health disparities, achieve health equity, attain health literacy, and trying to improve the health and well-being of all. Create social, physical, and economic environments that promote trying to obtain full potential for health and well-being for all. All those answers that say for all, that's a national standard. Bullet 4 was one of your answers. And then bullet 5, engage leadership, key constituents, and the public across multiple sectors to try and act and design policies that improve the health and well-being for all. So a lot is guided, a lot of public health, a lot of community health is guided by Healthy People 2030 objectives. And you need to know about this as well. This is going to be on your exam, this concept. Okay, so if you haven't looked at the website, please go back and look at the website. Okay, you have all already studied primary, secondary, and tertiary interventions, correct? In previous classes?
Yes.
Is that a yes or no?
Yes.
Yes.
All right, all right. So let's review. What is primary?
Prevention.
Prevention. What is secondary?
Screening.
Screening.
Can somebody mute, please? Thank you. Secondary is screening. What's tertiary?
Treatment.
Treatments.
Treatment. So the way I remember it is P for primary is prevention, S for secondary is screening, T for tertiary is treatment. Okay, and your rationale had a nice summary of these. Primary prevention is preventing something before it even occurs. And that's just not necessarily an illness or a disease or a condition. We're trying to prevent injuries as well. So a good example would be, let's say the school nurse is teaching helmet safety or seatbelt safety, or helping parents understand immunizations, trying to prevent something before it happens. Another way to look at secondary, your rationale now, is screening. Another way to look at it is early identification and early intervention. So you're screening for risk, right? So you're screening for early detection, trying to prevent complications, right? So let's say you've screened for risk. Let's say you've done a screening for obesity. Okay, and you found that you have a group of people that are at risk for obesity for whatever reason. Okay, screening is all about early intervention, trying to reverse a course of something before it goes into tertiary. In screening, we include a lot of things, right? But mammography, blood pressure screening, blood sugar screening, pap smears. What else would be examples of secondary?
Mammogram.
Yep, mammogram. What are some examples of secondary screening? Think of all the different areas that you could be working in the community. What would you be doing for screening?
Would A1C be one?
A1C? Yep, absolutely. What else?
Eye exams,
Exactly. Vision and hearing. Sure.
dental.
Dental screenings, absolutely. Behavioral risks. Maybe at risk for suicide. At risk for substance abuse. Okay, and then tertiary's treatment. What's important to remember with tertiaries, they must have something. Diagnosis, condition, illness. They've had an injury. Maybe a kid has fallen off his bike and has a TBI. Okay, you have to have something to treat. So you're trying to manage the disease to reduce the symptoms and try and improve quality of life. So let's say somebody has a TBI. We're trying to manage the symptoms until they get through, till they get as close back to normal as they can, right? Trying to improve their quality of life. So an example of tertiary would be medications. Low sodium diet for somebody with hypertension. Maybe checking blood sugars in a diabetic. Okay. The one thing before we get to the question, the one thing I want to mention about education, the word education as it relates to primary, secondary, and tertiary. A lot of times we think of education only happening in the primary interventions, okay, because we're educating to prevent. But it's involved in every level of intervention. So in primary, we're always educating to prevent, right? But think about secondary. Let's say we've identified a risk. Somebody is at risk for obesity, right? We still do education, right? On helping people understand that they are at risk for obesity, and we try and educate them on how to reverse that. So education is involved in the secondary level, and it's also involved in the tertiary. Let's say for me in the schools, I had new kids that were just diagnosed with diabetes. I had to be an educator for them on the disease and how to care for it in the school setting. So there was a lot of education there's a lot of education that takes place at the tertiary level. All the way through the lifespan. You may be working with elderly clients in the community setting, that maybe have been diagnosed with hypertension or heart disease. You're still teaching them what is a heart healthy diet. Does that make sense? So don't get tripped up on the word education only being in the primary intervention arena. It's in all three. Okay, so we know that A in the question we're asking for primary prevention. Okay, A is exactly what primary prevention is. Prevention of a problem before it occurs. What is B?
That's secondary.
Okay. Screening. What's C?
Tertiary.
Why?
Because it's the management of the disease.
So they already had it.
They already have something. Management of a disease. And what is D?
Primary.
Nope. Look at your rationale.
Oh, it's secondary.
Secondary. Remember, secondary, we're screening to try and identify risk early so that we can provide early intervention. Try and reverse that course before it gets to tertiary. Okay? There's primary, secondary, and tertiary questions on every exam, so we have to understand this concept. Okay, does anybody have any questions about primary, secondary, and tertiary? One of the other concepts that we covered in week 1 was the introduction to vulnerability. Before we even get to the question, what are vulnerable populations? Who are vulnerable populations?
Elderly, the
Homeless.
yeah, children.
Children?
um,
Who else?
People that don't speak English or speak other languages.
Absolutely. Absolutely. That's a big one.
Substance abusers.
Substance abuse. What about people with mental health issues?
Yeah.
What about our veterans? What about our teen pregnant moms? Who else are vulnerable populations?
Kids.
Yeah, kids are very big vulnerable population as well as the elderly. Okay, so hopefully you read this question carefully and picked out the word not. Okay. This is what we call a negatively framed question. We have a positive question and a negative question. This is a negatively framed question because it's asking you what is not considered. Okay, so obviously D is the right answer because the 16-year-old is considered vulnerable because of her age. Veteran, substance abuser. It's not that the 23-year-old with tuberculosis is not sick, but they're not in general considered a vulnerable population on its own. Okay, so let's talk about vulnerability. What's the meaning of vulnerability? What's vulnerability? Without reading just think out loud without reading the rationale. What's vulnerability?
People who need help.
People who need help. What else?
People who don't have resources,
Mhm.
basically to live, survive.
People at risk.
People that can easily be taken advantage of.
Exactly. Good. Really good. What else?
People who may not have the knowledge that they need.
To make informed decisions, right, Brinley?
Yes.
Yeah. What if you don't speak the language and you're trying to go to a healthcare facility and you can't communicate what's going on? Vulnerable people, vulnerable populations have lots of risks. Okay, so vulnerability is defined as susceptibility. You are susceptible to actual or potential stressors that potentially may lead to an adverse effect. Okay. Vulnerability to poor health does not mean that some people have personal deficiencies. And what that means is these could be related to genetic issues, right? So because you're vulnerable to poor health does not necessarily always mean that you have personal deficiencies. Okay? There are things in life, both internal and external factors, which you may have little to no control over, such as hereditary, genetics, family history. Right? Here's an example. A person may have some biologic limitations, including a genetic risk. Right? Let's say they have a genetic risk of asthma. Okay? That's made worse by pollution. Another risk would be lead-based paint, things that you have little to no control over, excessive noise. Let's say you live in a community that has a lot of plants, large manufacturing, industrial plants. There's a lot of noise. Let's say you live in a community that has a lot of older housing. You may be you're more at risk for exposure to lead-based paint. Let's say you live in a community that is a transportation hub, near an airport, trains, highways. You're going to be more at risk for being affected by air quality, pollution, right? Vulnerable populations are the groups which have an increased risk for developing adverse health outcomes. Okay. And the next question also talks about vulnerability. Which of the following is considered nursing interventions in caring for vulnerable populations? Hopefully you answered all of them. Think about it. When we're caring for, think about us as nurses caring for vulnerable populations. Of course, we want to increase resources, try and provide comprehensive services to people where they live, work, maybe in the schools, churches, neighborhoods, and workplaces. I already said that, but of course we want to provide increased resources. That's one of the most important things we as community nurses do for vulnerable populations, is trying to provide the accurate and essential resources that they may need. What are some resources in your communities for vulnerable populations? Do you have food banks? You have clothing banks? I know I'm asking. What are resources you have for vulnerable populations? Financial assistance, maybe? Help with bills? What are some resources you have in your communities to help vulnerable populations?
There's I believe
Is
it's Meals on Wheels.
Meals on Wheels?
Job and Family Services.
Child and Family, yep. What else?
WIC.
And we have it's called Community Action that helps with bills.
Okay. What about shelters for abused women,
Yes.
right?
Homeless shelters too.
Homeless shelters. Okay, the second answer, of course, we want to try and reduce health risks, right? Provide multiple services in one place or during a single clinic visit. Okay, one of the things we had in the schools, in our high schools, is we had clinics. We had on-site clinics. Right? So you could have families come in and get their kids immunized, have a checkup, do a vision and hearing screening. It's all about reducing risks. And a lot of times vulnerable populations, some vulnerable can't get to every single visit. Maybe there's transportation issues. Maybe there's work issues. So one of the ways to try and reduce health risks is trying to provide multiple services with one visit. Why is C important that we do for vulnerable populations as one of our interventions? Why do we want to assess the amount of stress for the individual and their family? Why is that important?
Stress could lead to like a lot of things. Like
Absolutely.
it could make you sick. It could also cause you to be like depressed too.
Mhm. Why? Give me some other reasons why it's important to assess the amount of stress.
It can kill you.
It can also prevent you from doing what you need to be doing. Maybe going to work, getting the kids to school, getting kids to appointments. It's important to assess the levels of stress to see if there are any resources we can provide the kids or the families. It could be as simple as the free meals in schools. Maybe they're living in poverty and don't have the additional finances for food. So it is important to assess the amount of stress, because the higher the stress level, the more vulnerability there's going to be. And remember, in the community, our clients can be individuals, they could be family units, they could be a subset of the community population, kids, elderly, diabetics, people, the people in your community with mental health issues. Okay. The other thing we, of course, want to do is D. One of our goals is to reduce health disparities in our communities. Right? Environmental risks, we know, are much more likely to lead to negative outcomes in vulnerable populations. So we have to assess their living situation, their living environment, and their neighborhood surroundings. Let's say you live in a community that has a high crime rate, a high gang rate, a low graduation rate, high levels of substance abuse, high levels of suicide, overdoses. If you're working in community nursing in a vulnerable community, this is what you're going to be dealing with. So one of your goals is to try and reduce those health disparities. Okay? So we know the vulnerability of it, the rationale now. Vulnerability has many aspects. Vulnerability often comes from a feeling of lack of power, limited control, victimization, maybe a disadvantaged status, feeling disenfranchised, you're not connected to the community. And certainly health risks increase significantly with vulnerability, right? Typically, remember, people are in those vulnerable populations that we've talked about often have multiple illnesses, both acute and chronic. Okay, we call those comorbidities. Okay. One of the things that we can do as nurses in general, across our whole profession, especially with the vulnerable populations, is trying to help them with developing resilience. Okay. It doesn't matter where you work now, where you're working now, or when you become a nurse, where you're going to be working. You're always going to be working with vulnerable populations. Are you not? You always are. What does resilience mean? What's the term resilience mean? What is being resilient? I think of you guys, the group of students getting ready to graduate, as being a group of very resilient students. What do I mean by that?
Resiliency means like when you get knocked down, you keep going.
Yeah.
you keep what is it, persevering, if I said it right.
Absolutely.
It's the ability to recover from or adjust successfully.
Exactly. Casey, thanks. Clorinda, thanks. Can you see how vulnerable populations may be less resilient? A lot of people that are very vulnerable feel helpless, feel hopeless, right? They don't see a light at the end of the tunnel, right? Whether it's their health status, their environment, their situation. Okay, so one of the things that we can do as nurses is try and implement strategies that will help them increase their resilience. Maybe it's resources that they need. Maybe it's healthcare that they need. A lot of vulnerable populations have issues with access to healthcare, issues to access to education. Okay, so to increase their resilience, what can we do to help them? Resources, healthcare, wherever they need. Okay, because we want to try and reduce these health disparities between vulnerable populations and populations that have more advantages. Okay. We'll spend a lot of time next week and the week after, I think week 3 and 4, talking about specific vulnerable populations. Okay, continuing on with resiliency. Which statement reflects resiliency? B, the more resilient you are, it's going to reduce your vulnerability to certain risks, right? That makes sense. Okay, A is just the opposite. Resiliency decreases the likelihood that you might get sick. And resiliency, C, does not depend solely on genetic predisposition. And then D is just factually incorrect. Resiliency cannot be learned if you don't possess it. Of course it can be learned. And further into resiliency, we know that resiliency is influenced by life experiences. Maybe issues, negative events in childhood that aren't dealt with through counseling or other approaches is going to decrease the resiliency. I saw a lot of this in the schools, a lot. Kids with issues that were not resolved, and as they went through elementary, I saw them in middle school, then in high school. It was a pattern. Okay, when you have high confidence, higher levels of confidence in your own abilities, that increases your resiliency. In kids, adolescents, and it helps them, it protects them from the negative effects of trauma or disaster. Maybe they've had a death in the family. Maybe their parents have got divorced. Maybe they are a victim of child neglect or child abuse. Maybe they see their parents in a abusive situation. Okay? Kids are very vulnerable. Okay? Very vulnerable to what their surroundings are. Okay? So we know that vulnerability can be reduced or reversed by increasing resilience. Talked about resources, useful nursing interventions, finding health, education, care coordination, and then obviously as nurses, if we can be involved in policy making at the state level or the national level, right? Trying to improve the health for vulnerable populations. Okay, any questions about that? Okay, one of our concepts in week 2 talked about families and family risks. Okay, so 5 functions of the family. Okay, the one that is not in here, the wrong answer is education. So again, this is a negatively framed question. What is not considered one of the 5 functions of the family? Okay, let's jump to the rationale. I want to talk about this. What's the definition of a family these days? Is there a definition? What's a family?
It could be anything. I'm just jumping in, because nobody's answering. So I'm just,
I know.
trying to get the time going. So a family could be anything, it could be blended, it could be a coach, it could be church members of the family, things like that. So it's not the traditional thing anymore. Family could be me and you. If we get close, we could be.
Yep. Yep. Read something here. There's no real definition of a family these days, like there used to be. It's whatever they say it is, right? Like Clorinda said, for the whoever provides physical, emotional, financial support, whoever that may be considered their family. There's ways we look to assess in community nursing. There's ways we look to assess the functioning of a family. Is it a healthy functioning family? Is it an unhealthy functioning family? Another word to describe that is functional versus dysfunctional. And we assess the family in these 5 different ways. Financial. Is the family planning for the future? Are they making good financial decisions? Are they providing housing, insurance for the family members? Health, teaching healthy behaviors, teaching healthy maintenance, providing maybe informal caregiving, caring for each other. Reproductive, perpetuation of the species. Are they able to care for the children in the family? Socialization. Are families trying to raise their children to fit into society, to become productive, responsible, well-adjusted adults? Do they pass on spiritual, religious, cultural beliefs to the family? And then the affective function. Are families trying to create a sense of identity and belonging with each other through affection, love, time together, bonding? Okay, every family has these 5 functions. It's how you assess them that gives you an indication. Are they a functioning family or dysfunctioning family? Okay, so I'm reading from the rationale now. Failure to meet these functions can lead to dysfunction, crises, stress. One of the strong contribution to the dysfunction of a family is potential substance abuse, anxiety, depression, missing work, unsafe sexual practices. Okay, we know that family typically is our first and most important safety net and social support system. Okay? Family helps to be, family is usually a primary coping mechanism within your family when things are stressful. Without it, there's a tendency towards not being able to cope. Okay? Okay, the school nurse is practicing a tertiary intervention in school. What is she doing? Everybody understand why A is tertiary? Why is administering a medication tertiary?
Because that's treating the problem.
Exactly. Exactly. What's B?
That's primary.
Primary. We're trying to teach these kids about good hygiene to prevent germs from spreading everywhere, right? What is C?
Secondary.
Secondary.
Yeah, and what's D?
Secondary.
Secondary.
Here's some examples in the school setting of primary, secondary, and tertiary. Let's review them just to keep hammering away at this. Primary, provide education on prevention of childhood injuries. So we're teaching about seat belts. Maybe we're teaching about helmet safety when you're riding your bike, playground safety. Working with the sports trainers to try and prevent sports-related injuries. Secondary, think about in the schools, early identification. So kids coming into the clinic, you're screening them, right? They have a headache, they have a stomach ache, they have a fever, they have a sore throat, sprains, anxiety, rashes, itching. You're screening them and trying to fix that problem there. Okay, tertiary, your answer was medication administration. Okay, you're treating for something. Okay. And then there's a couple of questions about some of your common childhood ailments. Okay, which would not be considered an appropriate intervention for a student with ADHD? Does everybody understand why D is incorrect? D is incorrect because you're making the assumption that every kid with ADD needs a one-to-one aid, and that's not true. Right? What if their ADD is under control? That would be rather punitive to assume that everybody needed a one-to-one aid. But the first three answers are good interventions for kids with ADHD, putting the kid in the front of the classroom, clear, short directions rather than several steps at once. And then we don't want to limit our outdoor physical activity as punishment. They need that activity. And the rationale goes through a bit more information about ADHD that I pulled from your book. Okay. You can read through that. And then another common childhood ailment is conjunctivitis. Okay, which statements are true? Everything's true except B. And that came from your readings. Conjunctivitis is not typically treated with antibiotics, right? But the rest of the answers are correct in that rationale. Again, right from your book about acute conjunctivitis. Okay? So, let me just take a peek at my notes here. I think we covered most of it. So for common childhood ailments, you need to read up about asthma. You need to read up about your type 1 diabetes. A really good resource for learning about your common childhood ailments, in addition to your book, is go look at the second discussion question thread. Everybody had to choose 3. And everybody had to talk about 3. Okay, thanks, Corey. Everybody had to talk about 3. Okay, so to reinforce your learning about each of these common childhood ailments, read through your discussion thread. It's an excellent source of information, right? That's what the rest of my notes were, is the common childhood ailments, which you're studying in peds anyway, right? Okay. Iron deficiency anemia. I know people selected iron deficiency anemia. I saw it. Scoliosis, lead exposure, scabies. I'm not sure anybody chose that, but you have to go back to your book. And each of in your maternity and peds book, you had a few reading pages with each of these. So please go back and review those, okay? Okay, I have a little activity here. Let me see if it's gonna, that was the last one. Okay. I just posted that. Okay. So I'm going to break you up into some groups, but I have to, hang on, I have to revise this. Ask the students. Okay. Oh God, I just posted it again. Okay. I'm trying to get the breakout rooms. Okay. So just write this down. If you're in room 1, you're going to be going to look at what is the education requirements for a school nurse. Okay. In room 2, you're going to be looking at the second. How are the requirements different for elementary, middle, and high school? That's room 2. Room 3, you're going to talk about what are the school nurse responsibilities.
You put that in the chat because, like you saying it fast.
It's in the chat. It's in the chat. Okay. I just can't break it out. I should have broken it
Oh,
out.
okay.
It's
I'm
in the
sorry.
chat. That's okay.
Um,
It's in there. So you've got, if you're in room 1, you guys are going to do a quick research. 5-7 minutes. We're going to come back and talk about it. So, room 1 is education requirements for the school nurse. Room 2 is going to be, what are we doing if, elementary, middle, and high school? Okay. And then room 3 is, what are you going to do? What tests are done? What do we do? What does a school nurse do? What does a school nurse do? What are her responsibilities? Okay. So I'm going to break you out into 3 groups. I want you to do some research and come back in 5-7 minutes and we'll talk about it. Okay. And I picked school nursing because that's my favorite. Okay. So I'm going to open these rooms, go in and talk about those 3 questions.
current license.
Okay.
But I don't think you need a BSN.
That's what it says when I look it up.
Guys doing okay?
Yeah, we kind of split it up and each of us gonna do a piece.
All right.
Okay, so listen, when I'm researching
Professor,
Yes.
are we getting out at 5:30 since we didn't take a break?
Yes, we are.
Okay.
Making every attempt to do that. Just waiting for the rest of the group. Okay, we all back? So group one, room one, what do we need for to be a school nurse?
At least a bachelor's degree.
Okay,
Yeah, so when I looked it up, it says a bachelor's degree and then a current licensure as an RN.
correct. So one of the different things that you need, yes, you have to have your RN licensure, but whatever state you're practicing in, you also have to be accredited for the Department of Education. So like for me, I had to have a Colorado CDE, Colorado Department of Education certificate to be able to, I was considered a teacher in the schools, and you have to go through a whole, all your CEUs, all your trainings. So not only you had your nursing license, but you had to be qualified through the Colorado Department of Education, and that's true in all the states. So, yeah. Group two, what do school nurses do in elementary, middle, high school?
what I found, it says a school nurse is to have a bachelor's degree, prepared registered nurse with an additional education leading to an Ohio Department of Education. And I looked Ohio because that's where I'm from. Leading to an Ohio Department of Education pupil service licenses, specific
Yep.
for the 1 year school nurse license.
Yep. You can't just walk into a school and be a school nurse. It comes with lots of certifications. If anybody wants to know about school nursing, I still belong to NASN, Look it up. It's a great website, National Association of School Nurses. It's wonderful. Okay, so what do nurses do? School nurses do at the elementary, middle, and high school level?
They promote wellness.
Okay,
They do health screenings.
okay,
Evidence-based interventions, preventions, and education.
yeah. What would
Provide
it-
support.
Go ahead. Keep going, I'm sorry. Provide,
provide emotional support to like the students and the families.
exactly. Yep. School nurses, as you learn through your readings, have multiple functions. It looks very different in the, I was a nurse consultant in the district. I wasn't site-based, so I had preschools, elementary, middle, and high school. There's roles at every different level. Okay, depending on who your population is, by age, by grade, by topic. Right? And room 3, what was your assignment?
That was room 3. What does the school nurse do?
Okay,
We just answered that.
okay. Who is the room that talked about different levels? Elementary, middle, high school. What were some differences?
That was room 2.
Room 3. What did room 3 do?
What does the school nurse do?
Okay. Where did you come up with room 3?
We all just answered that. Like, that's what we were
Okay,
saying. We
okay.
were all from room 3.
Okay, all right.
But
Fantastic.
another thing that I was thinking about is like a school nurse is also like of course, like a mandated reporter and advocate for children. So like if you see something that's like going on or that's questionable, I feel like that's also a really big part of your job as well.
Yep. So as a school nurse, you're a health educator, right? You may be a direct caregiver. In the schools, I was also doing direct caregiving, doing insulin pumps, giving insulin injections, EpiPens, inhalers, trach care, cathing kids, boys and girls, G-tube feedings. The scope of care with school nursing is very, very different than it was when I started 20-some years ago. Right? You're an educator to the administrators, to the staff. You're training the staff. You're teaching the students. Maybe they have a new diagnosis. You're also a case manager. Case manager, we'll talk about later on the term, but they're the coordinators of care. So you are the point person for the complex chronic illnesses with kids that have complex chronic illnesses, whether they need PT or OT or speech or mental health services, whether they have a one-on-one aide or have aides that work with them that need to be trained. There's a lot that goes on in school nursing, a lot. Okay. So I just want you to do a quick search on school nursing. I want to be mindful of the time. It's 5:28. We're done in 2 minutes. Does anybody have any questions that will benefit the whole group? And if anybody has any questions, stay on after if they want individualized questions answered. So it was good to see everybody today. I
Do
hope,
we have a quiz every week?
pardon me?
Do we have a quiz every week? Because I was not informed of the quiz that was going to be due today. So is a quiz every week or something?
Nope, it's all in your modules and in your assignments. There's 5 quizzes. They're in your
Because
weekly
when I
module.
pulled up my modules, it didn't show any quiz. It didn't show anything. So I'm wondering, like,
why don't you stay on after and I'll show you that.
It probably
Okay.
said it
Okay.
key graded assignment, and then after she unlocks it, it then says quiz number whatever we were on. So you have to look for the key graded assignment at the very bottom.
oh, because
It's also in your syllabus if you look in there.
Yeah, it's in several
But it's
places.
2 quizzes between each. It's 2 quizzes between each exam. So we
Okay.
have a quiz next week, and then after that, we have an exam. Then after that, we'll have a quiz, then we'll have an exam.
I also sent out a separate announcement last week
Okay.
that's specifically identified quizzes. And it was just a copy and paste from your syllabus and modules. You have quizzes in weeks. It says what week the quiz is in and what weeks the content is covered on the quiz. So there's an announcement specifically about
Okay,
quizzes
I
as
must
well.
have missed.
That's okay. So
Okay, thank you.
you're welcome. All right. So everybody have a good weekend. We'll see you next Friday. And remember, next week is your exam review week. So there's offerings of 3 exam reviews. I provided that early in the term so that maybe you could do some planning ahead with work or work schedules, family schedules, school schedules. So remember, next week is week 3. So it's exam 1 prep week. You'll all get the recordings. You'll get the recordings of all 3 live reviews as they happen. Okay. But it'd be great if you could attend them live, but you will have the recordings as well. Okay. Any questions?
Thanks.
All right. Good to see everybody.
No.
Okay.